Civilians in Sudan have suffered horrendous levels of violence during more than a year of conflict between the army and a rival paramilitary force, facing repeated attacks, abuse and exploitation by both sides. The aid group Médecins Sans Frontières, Doctors Without Borders, MSF, said, the physical and mental wounds of violence have been exacerbated by the collapse of the health system and the lack of an international humanitarian response. MSF said in a report, its teams had treated thousands of war wounded in areas affected by bombing, shelling of residential homes and essential infrastructure. It said, across Sudan, people's access to life-saving care has been drastically affected due to shortages, widespread obstruction and looting of medical supplies, insecurity and attacks against patients and medical staff, as well damage to healthcare infrastructure. It said, it accused the warring parties, the Sudanese Armed Forces, SAF, and the Rapid Support Forces, RSF, of blatant disregard for human life and international law. Neither side could immediately be reached for comment. The war erupted in April 2023, triggered by a plan to integrate the army and paramilitary forces in a transition to free elections following the overthrow of long-ruling autocrat Omar al-Bashir in 2019. Mediation efforts have failed to bring a halt to the hostilities. There is no accurate data on how many have been killed, but death toll estimates run into the tens of thousands. MSF said that in camps and gathering sites where refugees and displaced people have sought safety, patients have recounted horrific stories of inhuman treatment and violence perpetrated by armed groups on civilians. Accounts describe systematic cases of forced eviction, looting and arson. It said, sexual and gender-based violence are pervasive but underreported due to stigma, silence for fear of retaliation, and a lack of protection services. It said.